Good afternoon, Team Wright-Patterson family. It is a pleasure to be with you again for our weekly town hall meeting. I'm Colonel Thomas Sherman, proud commander of the 88th Air Base Wing and installation commander for Wright-Patterson Air Force Base. We truly appreciate you joining us again, and we've got a variety of information to pass out to you tonight and kind of give you a chance to share on what we've been doing over the last week. I think first and foremost in everybody's mind is really going to be going after what does a return look like. When we start looking at return to full capacity for Wright-Patterson, when we start looking at a return to capacity across the state of Ohio, our local area, what do these type of things look like? And so what I want to let you know is that deliberately, and we kind of teed up a little bit last week, but deliberately we have been working with all of the 115 mission partners that are here on Wright-Patterson Air Force Base. And what we've been doing is our Instant Command Center has been getting inquiries and getting information from them, specifically looking at what are some of their milestones, their points, their concerns, and the things that we need to do to start working through a variety of phases. So we talked a little bit last week about the phases that we need to enter, and in following with what our, the White House has put out and what the President's guidance has been, our federal authorities and what Governor DeWine is pushing out as well from his team, we're really melding a lot of those together to make sure that we're in lockstep, being good community partners, but doing the right thing that we need to do for the Department of Defense as well. On those lines, we have fully adopted the three-phase model that is really kind of taking part across the country. And in those type of things, I want to kind of set the baseline for this. So we really have to be smart and we have to be diligent on managing the expectations, because it's not like we're going to simply open the floodgates and everything is going to be open to us at one time. Instead, what we have to do is we have to make sure we're taking a very, very measured approach. We are still in phase 0 right now. And so I want to highlight again, we are still in phase 0. We are still sustaining the crisis. But right now we're looking at across the board on when do we begin to get to that point where we're starting to move into phase 1. So obviously a very, very important measure on this piece has been looking at that 14-day of downward trend. So our public health professionals, our medical professionals are staying in lockstep with the Greater Dayton Area Hospital Association, and they are sharing a great amount of information on locally where are we seeing the trend lines, how are we seeing the numbers, and really when do we start counting that 14-day downward trend, and then when do we start looking at incorporating the pieces on phase 1. So tomorrow we are holding with our 115 mission partners, key missions here, mission commanders across Wright-Patterson Air Force Base. We are holding a mission partners meeting, specifically bringing in the leadership on this so that we can start to describe to them what does that transition to phase 1 look like and what does that return to full capacity look like, specifically looking at the tripwires for phase 1. In doing that, we want to make sure that mission commanders kind of understand the parameters that our team has laid out, understand the inputs that we received from their subordinate leaders and their team members on what are some of the nuances for their organizations. So all of that is being presented tomorrow, because what we want to do is we want to get full buy-in, but also a full appreciation from our mission commanders on what latitudes and authorities are we giving to them, what do we need to expect from them, what can they expect from the 88th Air Base Wing in return as we are providing those necessary support activities so that they can do their mission. So in essence, we're really going to redefine that relationship on the supported organizations and us as the 88th as a supporting organization. And so I think it's really important that we're taking this time to truly have a virtual conversation on this so that we're getting the head nod from our missions commander saying, hey, we think this is a good way ahead in the plan. From there, we're going to tee up the discussion as to what phase 2 looks like. That could be 20 days down the road, it could be 30 days down the road from the time that you initiate phase 1. But again, it is all about what does the trend, the science, and the data tell us. And I want to highlight that we are really pushing to make sure that the decisions that we are making are based in science, they are based in data, and they are based in good practices. So all of this is happening along those lines. Now, with that being said, our telework capacity has changed the way that we do business. When we talk about getting the mission done for the United States Air Force, this is not a return to work, because we have been working. The families have been working to support. Our employees across the board have been working, and we have been getting the mission done for the United States Air Force here, which I think is phenomenal. So with saying that, the next level is, what does that new capacity look like? And so I was on a teleconference here at the beginning of this week in which senior Air Force leaders were letting all of their wing commanders and installation commanders know really kind of the thought process from their standpoint. And from the highest levels of the Air Force, all of them are telegraphing an important message saying, our ability to do work and how we do work has changed. And what COVID-19 taught us is not only do we have the resiliency to persevere through something like this, but what we've also learned is that we have the ability to get our mission done in an environment like this. So what we need to do is take advantage of the technological advancements that have happened here in the last few weeks and months, and we need to incorporate that as a new lexicon on how we as Wright-Patterson conduct the business and the mission of the United States Air Force. So it is going to look very different, not just from a social standpoint, but it is going to look different from a work standpoint and how we do that work. So stand by for more as we continue to look at what does our new capacity look like here at Wright-Patterson. An important component on this, and Colonel Fauci is going to talk about this in a little bit, but an important component and a question that comes up quite a bit is, hey, do we all need to be tested for coming in? What is the tested capacity? How does that work? So yes, testing capacity is coming a long way, but we are not there yet. And both Governor DeWine, President Trump, all of them have been saying that testing is moving along, but we are not there at the objective that we think we need to be at yet. But we also have to remember that what testing does is it gives us a moment in time. A data point in a moment in time. It is only a component on making sure that we are following good protocols, hygiene, social distancing, cleaning of our areas, utilizing shift schedules, cohorts, using all of these new tools at our disposal. That combined with the testing regime are the things that are really going to see us through and then help us measure how we're getting to our next step. So I wanted to make sure to hit on that as well. Another question that has come up quite a bit, and obviously a very important concern for our employees coming back, is looking at what are the child care options that are available and how we're looking at child care. So Colonel Berger is here to spend quite a bit of time talking on that issue because we know how important it is, but I wanted to kind of set the philosophy. When we look at our movements through the various phases, what we have to do is adjust all of our base support to that, as I mentioned. And being that base support is looking at how do we have to adjust childcare capacity to deal with a larger footprint of employees that are on the base, but also utilizing teleworking and technology to the maximum to offset that. How do we work our installation entry points and our gates? How do we work our services that we're providing? So all of those things are being looked at, and what we are trying to do is to tuck those in and nest them within each of the three phases. And so again, we're hitting on that tomorrow. So I wanted to make sure to at least tee that up to let you know that we recognize how important of a resource that is, and in recognizing that, it is a part of our deliberate planning on this. Also, I know that there's been a lot of questions and concerns when it comes to how do we do sanitization? How do we do cleaning? Are we going to get enough cleaning supplies and things along those lines? So our Logistics Readiness Squadron has just been driving hard on this, working with the Defense Logistics Agency, working with a lot of different sources. And so what's been happening is that we have got over 7,000 masks that are currently ordered. So we can make sure to get those out to our employee population. They are working very, very hard to make sure that we can find some level of supply chain for cleaning products and sanitization equipment. So they are diligently working that aspect right now. They are working both in the supply system, they are looking at commercial options, and we are even working with our local partners here to see if there are some local options that we could particularly use as this as well. So we are very cognizant of it, and what we want to make sure that we're doing is we're utilizing as many sources as we can to provide those supplies to our facility managers and our mission commanders to make sure that we're giving you the tools that you need to keep your working environment as safe as possible. Also, as we're coming up, we're starting to get into what everybody realizes and knows is PCS season. So on PCS season, as we're getting there, there are some real worries and concerns on what about exceptions to policy and what about TMO and our household goods shipment. All of that is being deliberately worked. So we have got a structure that is set up to analyze and look at all of the needs for mission essential moves, looking at people that already had their household goods that were shipped, things along those lines, and when do we start that movement going. And so the exception to policy process that we have is robust and it moves pretty quickly. Additionally, on that all call that we had here earlier this week with the wing and installation commanders, our A4 community deliberately said and discussed about the level of work that they're doing to make sure that they are unencumbering the TMO process so that our household goods, the services will be provided to our families that are moving. They are trying to break down bureaucratic layers. They are really working very, very hard to make sure that we are providing you, that if we've asked you to move, we are going to give you the mechanism and the backbone and the support to help get through that move. So I think those were the big issues that I wanted to kind of hit up as I tee this off right now. But I think the big thing to kind of close on this is that we are winning. The work that we are doing and the investments that we've made ahead of time are making a difference. We are seeing changes, and we have been protecting Wright-Patterson Air Force Base collectively. So with that, I would like to hand it off to Colonel Fausch to give you our medical group update.
Good evening, everyone. Thank you again. Thanks for having me here again, sir. I'm Colonel Mike Fausch. I'm the 88th Medical Group Commander, and I'd like to give you an update on our current status and a bit of information on the planning that we're doing as we go forward in the coming weeks. First, you should know that we continue to execute our mission under the declared public health emergency and within health protection condition Charlie. This means there is still a high threat to our personnel of transmission of the coronavirus. I'm sure you know that, but it's important for you to understand what is happening as we plan in the background. However, although we continue to have this high threat of transmission, we have been able to build our capacity and build our capability in the medical system through increased availability of testing, surveillance, tracing of personnel, personal protective equipment, and in conjunction with the state of Ohio recommendations, we're working slowly to build a plan to bring some of our workforce back to work. Now, you heard Colonel Sherman talk about testing, and part of this capacity in order to handle the disease is testing capability. We continue to build testing capability in the form of symptomatic testing of patients who present with symptoms and speak to their physician about whether they need to be tested. Many questions that we get over and over are about antibody testing, a serological testing which tests for the presence of antibodies in the system which may make you immune or increase the opportunity to be safe from the virus. However, because the virus is still so new, it's unclear how strong that immunity needs to be or might be in your system for it to last. The primary issue with antibody testing right now is a question of accuracy. It's just not clear yet how consistent a correct or a level of antibody needs to be in order for us to have confirmed confidence on antibody testing. And the inaccurate results that we could get right now are actually more deadly than consequences of not testing. And so although DOD is working towards antibody testing, we're just not there yet. And unfortunately, I don't have a good answer for when that kind of testing will come along. What I do have is items that have been working, as Colonel Sherman said, with regard to sanitation of your environment, social distancing, clean face coverings, and staying at home and reducing the amount of travel and interaction you have with personnel. Those items are working across our installation in order to mitigate the effects of this virus. Now, we're not working towards removing some of these restrictions because we think the virus is gone. Contrary to that statement, we're likely going to live with the presence of this virus for quite a while. Rather, we're planning to lift some of those restrictions because we have built up our knowledge of the virus, our ability to keep our personnel safe, and the capacity to handle the virus from a medical standpoint. Some of the items you know that we've put in place at our medical center include testing of symptomatic patients outside the MTF in order to protect our facility, our staff, and our patients. Virtual appointments have increased by 600% to allow reduced patient travel and reduced face-to-face interactions. Urgent and emergency surgical care and chronic medical conditions such as dialysis and oncology have continued through this incident. And we have separate points of entry for patients and staff with screening, visitor restrictions, and requirements for face coverings. We've also instituted the drive-through pharmacy operations to reduce congested areas within our facility. All of those items will continue as we plan for a phase one operation and a slow return to work. Some changes that we are planning to implement in phase one, though, will be gradually increasing face-to-face appointments to take care of our most vulnerable population, as determined by their physicians. Specialty care and surgical care we will prioritize some of our specialty and surgical care amongst the greatest risk to our patients. Our surgeons and our clinicians will be contacting patients to schedule those certain procedures and surgeries as we slowly begin to look into phase one. Although we'll be opening the availability for additional appointments, our staff is still going to be reviewing those appointments in advance in order to potentially handle them virtually, via telephone contact, or through secure messaging. We're also going to modify our clinic hours and stagger those appointments throughout the day with the potential for late afternoon and even early evening appointments in order to reduce the amount of congestion in some of our ancillary support services and our waiting rooms. And here's what we need from you. We need you to continue to wear those clean cloth face coverings around the base and when entering into the MTF. Those are recommended for children 2 years old and up and adults. I realize this can be very difficult for small children to keep their face covering on and to not touch their face covering and to move it around. So we understand, particularly at the medical center, young children, it's not a strict adherence to face coverings for those 2, 4, 5, 6-year-old children, but we do recommend that they continue to wear them. We are understanding that sometimes that's very difficult to have happen. We want you to keep your social distancing in our waiting rooms, like the main pharmacy, the lab, radiology, when you come in for care. We'd like to continue use of those virtual appointments and secure messaging to the greatest extent possible. And we'll continue to limit the number of visitors in the inpatient setting and outpatient setting. If you're able to attend your outpatient visit independently, this is ideal. If you need assistance, please limit that to one person. We are continuously monitoring the number of positive cases, the hospitalizations throughout the area, our test capability, our tracing capacity, and the capability of our medical community, along with federal, state, and DoD regulations and guidelines, in order to continuously adjust our operations and our recommendations for installation leadership. We have but one goal, and that's to get everyone through this situation safely. I appreciate your time tonight, and I'll turn it over to my partner, Colonel Paul Berger, our Mission Support Group Commander.
Thanks, Mike. Good evening, ladies and gentlemen. As Mike said, I'm Colonel Paul Berger, the 88th Mission Support Group Commander here at Wright-Patterson. I needed to provide you an update on where we stand with regard to our child development centers and help with some management of expectations as we move forward with some of the federal and state moves to lessen some of the COVID-19 restrictions that were put into place. So just as a quick recap, for just over a month now, our CDC at just one location is providing mission essential child care for our medics and first responders. So we're at max capacity right now in light of the coronavirus recommendations. And in spite of all that, we're still keeping up with the practice of social distancing and diligent, I would say probably constant cleaning of that facility to ensure that the facility is safe for the children and staff there. For those that do not have children enrolled in that facility, you've received a refund for any child care fees that had been spent, and you've been not charged fees going forward, as well as having your slot maintained within our CDC system. As we begin to move into the next phase of restoring the base to full capacity, it's important to understand that this is going to be a very measured approach, as you've heard from the two speakers prior to me, with guidance provided by the federal and state governments, as well as Air Force headquarters. This is the same way that we're going to be providing child care as we go forward. In short, the process will be slow and methodical to ensure the safety of children and staff alike. The next phase is honestly going to look very similar to the current state, with priority given to single military parents as well as dual military parents, followed by those parents whose leadership has deemed them mission essential, followed by our CDC staff members who have needs for child care. There's no way that those individuals can provide care for your children and mine if their child care needs are not provided for as well. So they're being given priority as well. And as we move through, as I've stated, the phases, additional child care is going to be provided using that same deliberate, methodical, measured approach. It's important to note that it's going to be some time before our facilities are able to take in the same number of children that they were before the restrictions were put in place. And this is really as a result of social distancing. As challenging as it is, particularly for little ones to be kept apart from each other, In light of that fact, we're not able to put into the classrooms the same number of children that we had in the past. We do need to give the children, as challenging as it may be, the opportunity to not be in close proximity to each other. So our classroom sizes are going to have to be smaller. They're not going to be filled to capacity. We just simply can't do that without jeopardizing the safety of your children and mine, as well as the caregivers. At this point, the exact dates of when the next implementation phase will take place aren't known. As Colonel Fouch and Colonel Sherman mentioned, much depends on how the virus trends in the coming days, weeks, months. What we can't afford is to have a resurgence of the virus at any level in any workplace, because all that's going to do is set us back by days, weeks, or possibly even months. So I can tell you right now that the Force Support Squadron leadership and CDC managers are working through a plethora of guidance. As you can imagine, we've gotten a lot of guidance from both the federal level, the state level, and the higher headquarters level on the processes and procedures that we need to put into place to ensure the safety going forward. The training of the staff is going to be a paramount consideration as well. The same practices that they become used to and been trained repeatedly over the years are going to be different now. That deals with classroom ratios, with cleaning protocols. Class integrity is one key difference. Children are going to be kept with their same group. They're not going to be intermixed between classrooms anymore, like what sometimes happens in the beginning and the end of the day. Caregiver integrity will be there as well. It will be the same caregiver with that same group of kids each and every day. Parents will not be allowed into the classroom past a certain point when signing children in. These are all new processes and procedures that we're going to have going forward, and the staff has to get accustomed to those and learn kind of what's becoming colloquially referred to as the new normal in this COVID-19 environment. I fully recognize that this is a stressful time for everybody, and the availability of childcare has a great deal, perhaps complete impact on a parent's ability to return to the workplace. What I can assure you is that we're working diligently to get your children back into our CDCs as soon as possible. I just ask for your patience throughout the process as we move through this deliberately and cautiously to ensure the safety of your children and the CDC staff. Thank you. Colonel Sherman?
Thank you, Paul. Appreciate that update. So now I'd like to turn it over to our PA staff, who's got some questions that you have teed up for us, and we want to go ahead and answer those before we close out tonight.
Sir, we got a couple questions
Okay.
here. The state of Ohio today came out and said that face masks are required in the workplace.
Mm-hmm.
Are face masks going to be required in all buildings here at Wright-Pat?
So the way that we're working through the face mask piece is we are blending the guidance and the authorities that have been given to us through the state of Ohio and so forth, and looking at kind of how Ohio is approaching this. What we're also doing is working that specifically with the Secretary of Defense's guidance. So the Secretary of Defense's guidance to us was really looking at when it is not practical for us to maintain the social distancing, then we need to maintain some level of face covering. So depending on the type of work that we are doing, depending on the type of environment that we're in, the specific building, location, the makeup, all of those factors are going into play as to what is the decision on mandating the face covering versus encouraging the face covering. So just know all of that is being worked with the specific mission commanders on that as well. And what we want to do is we want to meet the spirit of and intent that is being given by the state of Ohio as far as us being good partners in that, but we also want to make sure that we're adhering to the guidance that the Department of Defense is outlining as well.
Sir, a question about playground equipment.
Yes.
When will it be open on base and in the housing areas?
So good question on that piece, and we know that we have got a lot of our children that are wanting to get out and use some of that equipment, and especially a couple new ones have been put up here as of late. What I want to do is kind of approach that question really on the big level, because your question is important to that specific, but really when we look at it from the big level, this all fits into how does it fit into the appropriate levels of our phasing, and when do we consider it to be safe enough on that level? Because I think whether it is an outdoor gymnasium or recreation equipment, whether it's a jungle gym, whether it is going into one of our gyms or utilizing our bowling facility or so forth, any of those things are locations where there are high levels of touch and contact points. And in those levels of touch and contact points, we want to make sure that we are being as safe as possible before we get to a point where we, at wholesale, open those back up for you. So just know we are going to be tucking those into our various phases as well to make sure that the decisions that we're making to grant access to those are being made smartly with the advice of our public health professionals so that we can make sure that your children are having fun and staying safe at the same time.
Hey, sir, and sir, one final question. With telework being, looks like it's going to be the norm, are there any provisions in place for us to replace our desktop systems with laptops?
You bet. One of the great things that the Department of Defense and Department of Air Force has granted across this is that as we've been dealing in this COVID-19 environment, there have been certain authorities that have been given to us, and those authorities have been looking at how do we then equip our workforce and our employees so that they can maximize the use of that telework capability. So they've been given authorizations to make purchases, increase their technology capacity, get more laptops or tablets or other mediums that they can use to allow all of our workforce the opportunity to maximize the telework capacity, thus keeping us all in a much better position and safe. So I think we're in good shape on that. So what I would ask you to do is that kind of after I laid that foundation on that, what I would ask you to do is go to your supervision and start looking at your supervision to see if they can start getting on some of the purchase orders that are being made to increase the capacity within your workspace to be able to use that technology. So was that it?
Final question, sir.
Okay. Great. As we get a chance to wrap up, I just want to kind of hit a couple points, and I want to thank Colonel Fouch and I want to thank Colonel Berger for the information that they gave you tonight, and hopefully we're hitting some of these. We like looking at all the questions that we get, and I want to make sure to tell you again, we're going to keep the Facebook Live open. So any of the questions that you continue to write us in message, our team will be getting an answer back to you as soon as possible. Or sometimes what we do is we'll hold on to those questions as well, and we'll use those to help form our comments in the next week, because we're going to make sure that we're getting information to you that's important. So as we get a chance to close out, we are still in phase 0. We are still fighting this very important campaign together, and I use that word very deliberately. This is a campaign. It is not a battle. And thus far, we have been having great success in this campaign because of what we're doing together. Just know that as our life changes a little bit, as we go through those phases, as we look at phase 1, as we look at phase 2, there may also be a time where we have to go back and put more restrictions back on or go into a higher health condition level, simply because we have to do that to protect us as an installation, protect you as our friends and family, and protect the mission for the Air Force. So this is going to be a little bit fluid, and I think a lot of our leadership, government officials and Air Force leadership are all recognizing that it's going to be maybe a little bit of a dance back and forth as we may open some things up, find ourselves going back to another surge, put some greater restrictions on to manage it, and then move forward again. But no matter how many steps we take back, just know that every step that we move forward is progress. And all of that progress is being made from a lot of hard work. And the mission of the Air Force is getting done from a lot of hard work. A couple points to leave you with. Again, for those of us where our lives have changed, and some of us are dealing with this and spending a lot of time at home and feeling a sense of isolation or disconnected from being close to people we like. For those people that typically have a large circle of friends around them, this may be very difficult. For those that have family members that are struggling or suffering right now, we know that this is difficult. And I think I said this last week. If you are suffering and struggling, there is a support net that is here for you. So raise up your hand, because we will grab your hand and pull you up. Because our responsibility, us as a family, is to help take care of our family members, and that means you. So I'd ask you to do that for us, and we will make sure we get you the support to help bring you to a sense of comfort and calm. As we go through this, what have we been distinguishing? What have we collectively been distinguishing? It is fortitude. This installation and all of you, from our family members, our retirees, this population of over 100,000 people that make up the Team Wright-Patterson family, it is fortitude. We have displayed incredible courage and adversity. And that courage and adversity that we have been facing is causing us to have great success. The fortitude right now that you are bearing on your shoulders is that fortitude to realize that the fight's still on, but we're winning the fight. The fortitude that you are pulling together means that you may be able to make the person next to you, or the person on that line that's far away, or the person you're chatting with on the phone feel better about themselves or feel better about their environment or the work they're doing because of the fortitude that you're projecting. From our airmen that are at the gates to our airmen that are helping at our Kitty Hawk Pharmacy, Both the fortitude that they are giving to you hope boosts your day, but I know that the kindness and strength that you are pushing back to them is making their day worthwhile, and knowing that they are a part of the valuable team that is holding this installation up. So thank you for your fortitude. Thank you for the strength. Thank you for the courage in adversity, and thank you for joining us again tonight. PA team, thank you for nailing this again. For our ASL team, you are absolutely wonderful, and you bring us joy by simply being here. So thank you for that. Ladies and gentlemen, we look forward to doing this with you again next week. Thank you for joining us for our weekly town hall. We hope you have a wonderful rest of your week, safe, healthy, and we are making it. Take care, everyone.